Good afternoon, ladies and gentlemen of the media. The Premier, the Honorable David Burt, JP, MP, will give an update on COVID-19.
Good afternoon, members of the media. I'm joined today by the Minister of Health and the Minister of National Security. I will give an update on the latest regarding Bermuda and COVID-19 after I've just finished chairing a meeting of Bermuda's cabinet. First, the government did receive additional test results today. Out of the 6 test results received today, 5 cases were positive and 1 case was negative, meaning that the confirmed positive cases in Bermuda now stands at 32. 3 of the confirmed cases were imported. 1 had close contact with a confirmed case and is considered limited local transmission, and the 5th case is under investigation. 2 of the confirmed cases arrived in Bermuda on the British Airways flight on the 18th of March. Another arrived on the American Airlines flight AA308 on the 14th of March 2020. If you were on the British Airways flight on the 18th of March, your self-quarantine period ends tomorrow, April 1st. If you arrived on the AA flight from Miami on the 14th of March, your monitoring period ended on the 28th of March. If you were feeling fine and have no symptoms, continue to either practice social distancing or remain in your house and observe self-quarantine guidelines. If you have any respiratory symptoms, such as a persistent cough, a sore throat, or even a mild fever, please contact your doctor. Explain that you were on one of the mentioned flights and that you would like medical guidance. Do not go to your doctor's office or the hospital. Please ensure that you call ahead. I know that there has been some confusion in the public about definitions. Let me take a few minutes to explain the different terms. Again, we have 32 confirmed cases in Bermuda. Imported cases means that they were acquired outside of Bermuda. And as of today, out of the 32 confirmed cases, 20 of those cases are confirmed as imported cases, which means that the virus was likely contracted outside of Bermuda and brought into the country by travelers. As of today, there are 9 confirmed cases of local transmission. Local transmission is when a person has had close contact with a person with COVID-19. Close contact is defined as either at work or at home. Under investigation, this type of transmission has not yet been determined. These cases are not imported and are likely the result of local transmission. Investigation continues on these cases to determine the source of the transmission, and there are 3 cases under investigation. Recovered is defined as a person who has had no fever for at least 72 hours without the use of fever-reducing medication, and their other symptoms have improved, and at least 14 days have passed since they started to have symptoms. And it is important to note, again, that 10 persons out of the 32 have fully recovered. Bermuda's COVID-19 country status is considered local transmission. Currently, there is no evidence of community transmission. Community transmission is evidenced by the inability to relate confirmed cases for a large number of cases. What is clear, however, is the number of cases in Bermuda is increasing. And unfortunately, today, there are now 3 persons who are hospitalized with COVID-19 in the King Edward Memorial Hospital. The cabinet has met. We have discussed the current situation, and as is noted, if there is an escalation of the situation, we will look to possibly take additional measures. The cabinet, however, has decided that the curfew that took place, went into effect on Sunday, and is scheduled to expire tonight, being the last night, will be extended for a further 3 days from Wednesday, the 1st of April, to Friday, the 8th of April at 8 p.m. until 6 a.m. the following day. And it is important that we continue to work together to ensure that we reduce the spread of COVID-19 and flatten the curve so we do not overwhelm our healthcare system. Officers from the Ministry of Health and others authorized to do so have been in the community inspecting, advising, and ensuring the observation of social distancing guidelines within business that are still allowed to operate. This activity is being undertaken to help ensure vital businesses remain open and that social distancing measures needed to reduce the spread of this virus are contained. Regarding last night's curfew, the Bermuda Police Service has reported that there were no curfew breaches last night. This is excellent news because this indicates that as a country, we are taking this matter seriously. The Bermuda Police Service had officers positioned around the island together with 9 members of the Royal Bermuda Regiment on patrol. I am pleased that we did not have any curfew violations, and I encourage everyone in Bermuda to do the same again tonight. On the matter of allowing employees to work from home, as I've mentioned previously, this government has moved swiftly to implement regulations that make it mandatory for companies to allow employees who can work from home to work from home. I have stood here on more than one occasion and asked companies to make a way for their employees to work from home. Yet, I am still inundated on a daily basis with complaints from employees who fear that their workers are threatening their jobs with making sure that they come into work even though they are perfectly capable of working from home and have worked from home before. I did state that we would be passing laws, and the Cabinet, in meeting which just concluded, did bless the implementation of regulations under the Occupational Health and Safety Regulations, Occupational Safety and Health Act, and the regulations will come into effect tonight, which means that persons who are able to work from home must be allowed to do so, and their employer will be in violation of the law if they do not allow that. What is important is that the staff that do believe that their employers are possibly violating the spirit and letter of the law have the ability to report such a violation. And to ensure that Bermuda's employers work for the health and well-being of their employees, the government has created a labor complaint form. Employees can complete the form and submit it to the Ministry of Labor, Community Affairs, and Sports, where the Labor Department will process and investigate each complaint. The Employment Violations Tip Line can be found at the following website address: www.bermuda.bm/EVTL. It stands for Employment Violations Tip Line, and we will put a link to that particular website on the website coronavirus.gov.bm so everyone can find it. I would like to extend a sincere thank you to the Attorney General and Minister of Legal Affairs and the Minister of Labor, Community Affairs and Sports and the Minister of Health for working to put these regulations into effect quickly, as it is important. Just some brief updates on other matters regarding the Hamilton docks. In an effort to maintain safety, efficiency, and relieve congestion on the Hamilton port, all local importers are urged to pick up their containers as soon as possible. The Hamilton docks are starting to get congested and would like to move some containers in and out of the port and to maintain the shipping schedules. Therefore, if you have a container on the dock, please make arrangements to move them as quickly as possible to ensure Bermuda continues to receive necessary food, medicine, and other supplies. To ensure healthcare workers can get to and from work in the absence of the Department of Public Transportation Service, as workers at the Department of Public Transportation have withdrawn their labor, minibuses will be invited to bid to provide this service at a reasonable fee for service. I am extremely disappointed with this development from the staff at the Department of Public Transportation. And this afternoon, I sent a letter to public officers reminding them that they must move beyond the barriers of their job in order to provide service to the people of Bermuda as they are public officers. We will each be called upon and asked to work in a different capacity to keep the country running. And it is only together that we're able to come through this unprecedented global pandemic stronger. I have also made sure that it is made clear from the Cabinet, and the Cabinet has full support, that public officers that do not wish to report to work will not be paid for the time of which they are absent, and that money will be used to fund the minibus service. Tomorrow, the Minister of Finance, in conjunction with the Minister of Labor, Community Affairs and Sports, will host a press conference to give an update on the unemployment benefit. However, at the Cabinet today, it was confirmed that the payouts for the unemployment benefit will be made this Thursday and Friday, so persons can look forward to receiving those particular benefits. On Thursday, the Minister of Finance will also hold a press conference to discuss Bermuda's current economic position and what the government will be doing to help support the economy after we come out of this particular crisis. The final note that I have today as an update is that under the work of the Minister of National Security, there was a shelter for vulnerable people which was set up at the Barclay Institute Gymnasium. That shelter has been open for the last 2 nights and will again be open tonight. The shelter, which opens at 6:30 p.m., provides a hot meal and a place to sleep for those who are otherwise without shelter. That concludes my remarks. What I'd like to say is that the additional cases and the additional one under investigation does mark a different stage in our affairs. That is the reason why we have extended the curfew, and we're going to continue to have a conversation with the epidemiologist, and I'm going to seek advice from the Chief Medical Officer to see whether or not she believes that additional measures should be taken. Every day in closing, I thank the staff that are working on the front lines. I thank the public officers that are doing their particular work to make sure they are being flexible so that we can continue to provide services for the people of this country. And I will continue to thank them as we all work together during this incredibly difficult time. With that, I'm happy to take any questions that persons may have.
Good evening, Premier. How are you?
Good, thank you.
First of all, let me ask that question. How are you making up for the stress, you and your ministers? How are you faring with the stress of this particular stuff you have to deal with on a daily basis?
It's an incredible, stressful situation. That's just the nature of the business, but it's a job I was elected to do. But I have the support of the community, and I'm grateful for the support of the community. I'm not the only one who gets to work. It is a cabinet of 12, which is ably supported by a team of senior public servants who have continued to work day in and day out to make sure that we can manage this crisis and continue to deliver what we have to do for the people of this country. So I thank you for your question. I would be lying if I said that I'm not feeling a little bit extra stressed and a little bit extra tired. But the stress and tiredness of which I'm feeling, I'm sure, is mirrored by many Bermudians who have to worry about their children at home and a different routine. But the fact is that we're doing this to make sure that we keep our country safe, and I'm sure we're going to continue to do so. I tried to make sure that I have a little bit of levity, and in that particular case, I saw some persons commenting on Facebook about my red and blue pocket square. So today I decided, I promised them that I'll wear blue and blue today. So for those persons who asked me to wear blue and blue, there you are.
I asked yesterday about the airport, the construction, I would take this on hold. Are there going to be any penalties for if the airport is not concluded on time?
I can't necessarily speak to that. I'm happy to get further information on that particular issue if there's going to be any additional penalties due to this particular act of God. But given it is an act of God, I sincerely doubt that that will be the case.
Thank you. Why are you only testing symptomatic persons, and we have asymptomatic persons that are, could they be spreading, other persons can be spreading this virus?
I think the Minister of Health has spoken to that on a number of occasions. What I'm going to say is that the World Health Organization guidelines do not suggest that you test persons who are asymptomatic. We are testing symptomatic cases of confirmed contacts, And it is done, remember, with a recommendation from a doctor. So the doctors are the ones that are coming, and the doctors are the ones that are making those recommendations. And whomever the doctor recommends are the persons that are tested. There are a number of persons that are scheduled for testing. I think there's a number of persons who are scheduled to receive testing today. A total of 24 people who are going to be collecting, that are going to have samples collected today. So we are continuing with our aggressive testing regime. As the Minister of Health noted, that 400 additional testing kits arrived on island yesterday, and we're going to continue through that testing process.
Community transmission, do we have data on that particular issue? Or could this be sending a full sense of security throughout the community?
As I stated in my remarks, there is currently no evidence of community transmission at this time.
In the States, there are many stories about pregnant women being contracting this virus. TNN understands that one woman, a pregnant woman, yesterday was tested positive. Are you aware of the circumstances?
I certainly wouldn't be able to be discussing any individual cases because that would violate patient confidentiality.
Don? Hold on, Jasmine. Go ahead, Fiona.
Thank you. Thank you very much. We have now 3 cases under investigation, and I think on Sunday you'd hope to give an update on 2 of those cases. Obviously you've been unable to do that so far. I just wondered if it's possible to give a little bit of explanation about what under investigation, what actually happens under investigation, what the process is.
I'll let that to the Minister of Health.
Thank you.
Yeah, thanks for that question. A similar question was asked yesterday about that. As you'll recall, I spoke to the question from Don Burgess. There's a process of contact tracing that has to take place. So once a person tests positive for COVID-19, the epidemiology and surveillance team then starts the exercise of contact tracing. The first persons that they will contact are the immediate family members or those housemates of the person that is tested positive. Then their antenna, so to speak, goes out further. So then they will look at those other persons that they may have had close contact with, such as their employers, their workmates, if they participate in any type of function, activities that involve a lot of people. So it starts narrow, as in your immediate household, and then it continues on to grow depending on the circumstances. Some of those persons that the contact tracing may take only 1 or 2 persons because they live a very insular life with perhaps just one roommate, and they may work in such a place where they are actually on their own because of the nature of their employment. Or alternatively, you may have to contact trace individuals who may live with 8, 9, 10 people. So therefore, you could appreciate that the contact tracing would take a lot more effort because it's a larger group of people that need to be investigated, so to speak.
Understood. Thank you very much. And Premier, you mentioned with regards to regulations against employers who are trying to make people come into work. Forgive me if I missed it, but what are the penalties in place for those employers?
The penalties are under the Occupational Self and Safety Act.
$6,000 penalty. I don't have it with me. We literally just, I think I signed it a little while ago. I think it's $6,000. I don't actually have it in front of me right now. I want to say it's the $6,000. No, I think it's a $10,000 fine, but I don't have it in front of me right now. It's literally next door. I can give it to you when we finish. Yeah.
No worries. Thank you very much.
Okay.
Okay, and go ahead, Carmen.
I wanted to ask, how many Bermuda Regiment soldiers are embodied with this call-up, and do you think it's going to escalate? Do you think you'll need to call up more?
Can you repeat the question, please, Trevor?
How many people embodied with the Bermuda Regiment? If there's a need or this escalates, do you call up more soldiers?
Question is, how many soldiers are embodied with the Bermuda Regiment, and if there is a need, do we have the ability to call up more? Right now, there are 96 soldiers embodied with the Bermuda Regiment. We have the ability to scale up to 250 soldiers if the need does arise.
And for police officers that are doing desk work, if need be, the same scenario.
There are approximately 411 members of the Bermuda Police Service. On April 6th, all of officers with employed by the Bermuda Police Service will become operational. They will put on their uniforms and they will be sent to various locations by the Commissioner of Police.
Okay, Jasmine?
Yes, good evening, everyone, Mr. Premier and Ministers. I guess my question is directed towards the Health Minister. Regarding the patient who tested positive off of the American Airlines flight on the 14th of March, when was this person tested? Because the 14th of March was 17 days ago, and that would have passed the government's 14-day quarantine period.
Okay, actually, Jasmine, I don't have that information with me right now. I think, I couldn't say. I don't have that in front of me insofar as the testing date for that particular individual.
Okay. Would the ministry consider extending a quarantine period if a person's symptoms, do not show within the 14-day incubation period?
When a person tests positive, for COVID-19, once their symptoms have dissipated, there's no fever without having to take a fever-reducing medication, etc., for 72 hours or 14 days after the positive results, that's when the quarantine period, it will be isolation at that point, period expires, whichever is the latest period of time.
And what sort of medication is initially prescribed for patients who do find themselves with a fever or other related symptoms?
There's a lot of things like paracetamol, acetaminophen, over the counter. It's actually over the counter medications that are normally prescribed by the doctor and or the healthcare provider to treat the symptoms.
Thank you.
All right. Any other questions?
Nothing, Doc? Nope. Nothing? Okay. With that, I want to thank members of the media for their attention. I want to remind persons that the government has extended the particular curfew period, and we continue with our plan of aggressive testing. And as I had indicated previously, given the new test results, I'll be conferring with the Chief Medical Officer and the Minister of Health to ensure that we are in good stead to prevent community transmission, and happy to give an update if there's any change in our current situation.